32 publications in reputed journals and conferences. He is associated with societies like Society for Neuroscience, and there are also many ongoing projects going on under his supervision. And for today's session, sir will be covering the topic meditation and its health impact, scientific evaluation. So I request all the participants to please be attentive during the session. Sir, can we start with our session?
Yes, thank you so much. And I am very much happy to share my experience and my whatever we have learned in the field of yoga to understand how this yoga can be a socially relevant science. That is a very important starting because yoga is something which is good for self as well as it's very much important for the others. So with this starting, I'm going to share my screen. Just 1 minute. Yes. So as Madam has mentioned that meditation and its health care impact or health impact. So before going for the understanding about the yoga, as you have learned so many biomedical signals so far, I think last 4 days, 5 days, it was completely imbibed with so many biomedical signals. How these signals are getting changed over a period of time when we are looking at human physiology. Similarly, I'm going to start my presentation with healthcare. Why health is important today? Almost entire world, the maximum funding is given on the healthcare. My slides are visible, right, to everyone? I need response. Anyone can respond me.
Sir, it
My
is
slides are
visible.
visible.
Yes,
To
sir, it is visible.
Yeah, so I'm still in first slide. So as I told you, today we are talking about the healthcare, though we are in the most advanced era of this century. We are in 21st century, which is the most advanced. And sometimes we say that it's the most advanced in terms of technology. We are having a most comfortable life. If we want anything at any point of time, we have fastest transportation. If you want to get any transportation, we can get. Today we have. If you want to reach
So
somewhere
sorry
within
to
2 hours,
interrupt.
2.5 hours, you can reach. Hello.
So sorry to interrupt. Sir, actually your screen, your slides are cutting from the downside.
Okay, it's cutting from downside.
Yeah, like
Just
physical comfort. Yes, sir.
just give me a minute. Might be the slide. I think we can. It's not a wide screen. It's a standard screen, I think.
So you put it in slideshow mode, it will be done, I think.
Okay. My slide pattern is completely changed. Yeah, it was in slideshow mode. Let me do it once again. Uh, Now, is it? Let me know if it is still cutting from the down.
Right now it is okay, sir.
Okay, fine. Yeah. So as I was telling you, today we are having a most comfortable life because of technological and because of development around the globe. And we are having a fastest transportation, fastest communication. If I want to communicate from here to another side of the earth, I can easily communicate. So such kind of things are available today. I think 50 years or 100 years back, such kind of comfortable life was not available. We are having most of comfortable life, luxurious life on this earth. We are having very high buildings, which is we can be developed overnight. Sometimes it takes few time because of development in the technology. If we want nowadays, everything is available so easily. But after having all these things, after having such much this much development, we are talking about the technology, we are talking about the healthcare, we are talking about the other development. But still, are we really happy or healthy? That's what is I was starting that today we are little bit talking about healthcare first, and then I'm going to talk about the yoga and meditation. Because unless we don't understand the concept of health, in terms of we know the concept of health uh, as defined by WHO, as defined by different kinds of people, different kinds of books, they have defined the health. But real health, what we want to achieve, are we going in that direction? We are having a best technological equipment, we are having a most comfortable things, but still we are happy. Why we are not happy? Because we don't have we don't do much physical activities. Why? Because everything is around us. We don't have we have a concept of no time. That is another major problem in this century. Concept for self we don't have. From morning till evening we work for others. Do we have time for ourselves? Are we spending time with our own concept or our own interest? So this is another big challenge nowadays in this, because we our demands are keep on increasing, and because the demands are increasing, the problems are keep on getting up, is gearing up, along with the physical problems, along with the mental workload, the mental agitations are keep on increasing, and because of that, because of the demand is more, the concept of rest and the concept of time is completely gone. We don't have time to take a proper rest, and we don't have a concept of for ourselves, spending time on ourselves. And there's so much workaholic. We don't care about the physical activity, we don't care about the food, and we don't care about the sleep. These are the three major factors which always associated with our health. Since this entire workshop is also based on healthcare system, when we talk about the healthcare system, technological development is simultaneously important along with the understanding, the conceptual understanding about the healthcare. So, as we are growing toward the development stage, the problems are also associated with that, like water pollution, air pollution, soil pollution are keep on increasing, and because of these, the changes in the environment are increasing. What we are facing, we are facing the problem in our health. And today, the entire technological system is talking about healthcare system. We have best of the best medicine. We are having best of the technology to diagnose ourselves. But still, we don't have the concept of how to reduce this stress. There is any medicine to reduce this stress? No, I don't think any medicine so far or till today is developed by any medical scientist or any technological development who can reduce this stress, anxiety, worries, and lack of time concept. Fast is very difficult to reduce this stress. First is concept is stress. Why stress? Because which is an silently invasion of our own whole entire system. It is invasion, it is doing invasion in our whole entire system, like a terrorist, they do attack silently. Similarly, these things, stress, anxiety, lack of time for self, that is another major problem. So these are the big issues in today's era, where we are running behind the dreams and we are lacking our physical health. So our mind is growing very fast. Problem is that the mind is growing very fast, the brain development is happening very fast, but the physical body is not going along with that. Our physical body, the changes in the body, is not accompanying with our mental efforts. Mind is reaching to the Mars, but our physical body is still on the earth, and we could not able to uplift the body from ground level to higher level. That's the concept given in the yoga, where we are moving from lower consciousness to higher consciousness. We say that we can move from the very lower consciousness, where we are in the from the animal to the human being to the superhuman being to the superhuman human consciousness. But this concept is completely not available till today in healthcare system, and because of that, people are not having the time for self. They are impatient. The and other side, the technology addiction. As you know, because of this COVID, most of the things are happening online. Most of the things are using the technology-based development is happening. But this technology development, based development are associated with several kinds of other problems. Yesterday, I was reading one article about NCDs and how these NCDs are grown up during this COVID situation, and it was completely different like early before COVID because people are having a lot of inactivity. They are inactive physically, physical inactivity, lack of sleep, and poor diet was a major problem during this COVID situation. And the change from healthy to the non-communicable disease is increasing. And the other side is technology addiction. Earlier, nowadays students, children are facing a biggest problem of this addiction, technology addiction or a smartphone addiction. Everything now, entire our community, entire society is now inside this whole wall of a screen that's called a smartphone or a laptop. The entire society is inside that. Even our entire brain activities are inside that for boundaries. Sometimes these boundaries are limiting and creating a lot of other problems for the children. Nowadays, children are facing the problem of the smartphone addiction. That's a very growing problem in the globe. The global problem is smartphone addiction. Children and then the adults are associated are having a lot of problems because of physical inactivity, and they sit whole day and night in front of the screen and they do their work to achieve their dreams. But for achieving the dreams, we are lacking a lot of things. Once we are getting the so many, for example, if we get something after doing this much hard work, we may have not a healthy life that time. We may be on the ventilator or we may be on the hospital bed. This is the situation right now in the current problem in healthcare system. And because of these many, which I told you about the stress, about the changes in the life pattern, because of the addiction, the problem is not happening only in the mind level. It is creating, of course, a lot of other problems. It is creating a problem in the metabolism. Our entire metabolism is getting disturbed. The hormonal imbalances are able to keep on happening. Nowadays, the women's have a tremendous amount of problems, including their menstrual problem, including their PCOD, including their so many other factors like pregnancy problems, and equally the males are also facing a lot of challenges because of the life is going very fast. Life is, and because of that, so much changes are happening in the body, and our entire nervous system sometimes is getting collapsed. We don't know what to do first, what to do next. Sometimes we are completely confused if because of the load of work on the brain, on the mind, and this mental workload. Because of, as the load is increasing, the efficiency goes down. As the mental load increasing, the efficiency goes down, as we have seen in different kinds of tests, like when people are performing n-back task, as you are increasing the memory load, the sympathetic arousal is also increasing, and sometimes mind could not able to retain the number of alphabets. So similarly, our body is also playing the same role. And in healthcare system, when we talk about the non-communicable disease play a major role. Why? Because it is increasing because of stress. As I told you, there is no medicine on this earth which can reduce your stress level. There is no medicine on this earth which can reduce your sympathetic arousal. Is there any medicine which can reduce your sympathetic arousal consciously? I'm sure there is no medicine till today. So these are the, and all these problem of non-communicable diseases because of poor lifestyle, and that's why sometimes it is called as lifestyle disorder. And when we are talking about the lifestyle disorder, it is equally important for healthcare system to look at the cause, not the symptoms. Most of the time, doctor look at our symptoms and they they give you some kind of medications. But now we have to look at some other direction, because still, if we today we are talking about diabetes, it is keep on increasing. Though we have a modern healthcare system and we have a best technological to diagnose, to reduce, or to operate, or to do any kind of surgery, we have best equipment. but still we could not able to reduce the burden. So non-communicable disease is also called sometimes psychosomatic disease because it starts from the mind and it is going to reflect from the body. Mind is not going to not going to reflect you immediately, but because of mind which perceive the stress from the surrounding, and because of this surrounding stress, it is going to reflect on the body. That is very much important. People are doing a lot of rest there because of they are thinking that people are thinking to avoid the stress by using some kind of alcohol, by just taking doing the long nap of sleep. That's not going to reduce the stress. Absolutely not going to reduce the stress which is at the mental level. Yeah, physical stress can be reduced at some time, some kind of ways by long hour of sleep. May you get some kind of sleep, but may you get some kind of physical relaxation. But there are some other which I'm going to talk about later. How this sleep is also associated with physiology. So as you know today, as the the problems are increasing in non-communicable diseases, and how we are diagnosed, whatever technology we are using, still we could not able to control or retain or to, and it is keep on increasing. As today's it was report WHO report in 2020, 70% of all death are due to non-communicable diseases. Whatever deaths are happening around the globe is around 71% deaths are happening, and you can see in one of the graph where I have mentioned that around 20% problems are this is entire graph of this, and around 31 to 31% deaths are happening because of cardiovascular disease, which is also a problem of which is a part of non-communicable disease. If you take a stroke, if you take any cardiovascular problem, it is associated with their stress, even hypertension, ischemic disease, any other problems if you take, all are in combined is called cardiovascular diseases, and around 30%, 31% deaths are happening because of cardiovascular diseases. Then cancer, then chronic other respiratory disorders, then diabetes. Diabetes is also growing very fast. If you look at the recent trend in diabetes, though we are having so much advancement in the healthcare system, in medical care system, in medical infrastructure, but still we could not able to control the diabetes and cardiovascular disease, which is keep on increasing day by day, and it is going to create another big problem in upcoming eras. And similarly, because of this non-communicable disease are increasing, the budget allocated, as I told you earlier in my first slide, the budget allocation, the burden, the global burden is keep on increasing because of this global and because of this non-communicable diseases. And the budget is keep on increasing, the financial requirement for development of healthcare system, the development of medical care system is keep on increasing. Around last year it was 2 crore 64 lakh 2 crore 64 lakh something they have allocated, 2000 crore, sorry, 2000 crore they have something allocated for Ayush healthcare system. And now when we talk about the budget as increasing to develop the medicine, to develop the surgical equipment, to develop the diagnostic equipment, are this is the solution we are looking for? Are we are having a best medicine, but still there are no specific cure. There are so many medications are keep on giving to the cardiac patients, to the diabetic, to the metabolic disorder patients, to the musculoskeletal disorder patients, but still are their problems are getting reduced? I think there is no definite solutions are coming out so far. Till today, we don't have any medicine or any medical treatment for diabetes itself. If you look at the back pain, till today we don't have any medicine to reduce to control the back pain. We can reduce for temporarily by using some kind of anti-analgesic tablets or painkillers, but those are not the permanent solution. If you keep on having those medicine, it is not going to solve the problems, because it is going to create a problem on your kidney, or it is going to change your metabolism. Again, the problem is going to increase, and these medicine are not going to give you a perfect care of your health because of their side effects, and sometimes you will be dependent for long term. If you once you get diabetics, so once you go to doctor will give you prescribe some medicine which you have to take over a period of time. Sometimes people take these medications till death. Same with the hypertension, same with the any cardiovascular disease, same with the cancer, same with any other problems. Take up any issue, any health issues. So all these things are creating a lot of problems on the humans, and they are getting the problems. So are we going in the right direction to look at the solution by developing so many medications, by developing so many gadgets? It's good to look at to look at to diagnose at early stage. Early stage diagnosis is very much important. But sometimes medication may not give the sufficient benefits to the patients. Sometimes this technological development may not give us the benefits to the patients. So, so where are we? As I told you, the graph is keep on increasing. Look at the non-communicable disease graph, which is keep on increasing, and it is going to be create a more problem, persistent problem for the healthcare system. And healthcare system is not having solution. So, where what is the failure? Why we are failure? What is the lacuna in our treatment modalities? Why we are using though we are having so much development, but still we don't have we are not treating the disease because the doctor, if you go to doctor or if you go any person, they will try to treat the symptoms, not the cause. And the major cause of this non-communicable disease or any disease, if you take up, if you look at this COVID is maximal around 70 to 80% people were infected. Those who are having already non-communicable disease, having hypertension, having a stroke, or having cardiovascular problems. Their immune system was a little bit poor. They got very much infected with this COVID situation. And what is the major cause of this? Is unhealthy lifestyle. Unhealthy lifestyle is a major problem which is associated with any kind of even we are if sometimes we are getting mental stress is because of unhealthy lifestyle. Stress is not something with very new thing, very unique thing. Stress was earlier also. Before 20 years or 50 years or 100 years back, people were here having this stress, but they were having the strength to deal with that stress. They were having the stamina. The immune system was very strong to deal with such kind of stress, any kind of stress. But today, because of our demand is more, our desires are keep on increasing. We are facing the problem of unhealthy lifestyle that include physical inactivity. Because of this modern technological development, we forget to walk. Once we are diagnosed with some kind of problem, we think that okay, now we should start morning walk. Once somebody got diagnosed with hypertension, doctor suggested then only they go for walk. It is similarly like people wear the helmet only wear the helmet because of they are afraid of paying the penalty when traffic police will catch them. They don't care about the health, their oneself. We should wear the helmet because of our safety, right? Our family safety, not because of somebody else is going to impose that rules. In a unhealthy lifestyle, in sedentary lifestyle, the first is physical inactivity because of everything around us. If you want food, now food can come to your house within a few minutes. In 10 minutes of delivery of from the Domino's or Zomato or so many agencies are there which provide food very quickly, and which is unhealthy diet, which is also a major problem in the lifestyle. Addiction is another big major issue, including smoke, alcohol, technology. Drug addiction is also a very big issue now in young generation. And technology addiction, as I told you, these kids are very much affected because of this smartphone addiction. Even they eat food not because of hunger, because their mother tells, okay, watch this cartoon, I will feed you. So while watching the cartoon, they take the food. It means the food is connected with the mobile, not with the hunger. That is another major problem now coming up in the children. Even their learning abilities are getting affected because of this smartphone addiction. And last is less or too much sleep. Sometimes people sleep around 3 to 4 hours just before exam. Whole night they will be awake and they'll read whole night to get to prepare for the exam on the next day. Or some people they sleep around 8 to 9 hours, 10 hours, and they think that the problem will be solved. No, the optimal sleep around to 5 to 6 hours is very much important. Oversleep and less sleep deprivation both are going to affect the body, uh, which are going to affect your mind, because if you don't sleep whole night, whatever you have remembered, whatever you have studied, and on the next day of the exam you may write, but it will not retain for longer duration in our brain. Why? Because the when we read something in night and we are not doing the rehearsal or revision, it is not going to consolidate in the long-term memory. When something is not going to retain in the long-term memory, then that is not going to be useful, and you will may forget after some time. And sometimes in the exam, people remember those things which they learned in the classroom or in the discussion, or sometime back in the sometime back before the examination. Just before the examination, whatever they studied, sometimes they could not able to retain or recall those things. That is another. So too much sleep and too less sleep, both are very problematic. But in yoga, and I'm sharing you one study which we have done in the lab, where we have seen that yogis they used to sleep around 3 to 4 hours, and they was active whole day. Then we studied some kind of meditators, those who are doing meditation around 8 to 10 hours every day. They around 8 to 10 hours they are doing meditation. And when we observe, the onset of sleep was very less. As soon as they hit the bed, they go into deep sleep. They don't spend much time in the dream sleep or in the initial stages of sleep, NREM 1 and NREM 2. They go directly into third and fourth stage. Whereas in non-healthy people, what we observe, they are spending a lot of time on the onset of sleep. As soon as they have the bed, around 30 minutes they take to go into the sleep, and then they are spending more time to transient phase. Okay, the transient phase from the wakefulness to sleep, that's called REM sleep, random eye movement sleep, which is also called dreaming sleep. So people are getting a lot of dreams during the sleep, which is sometimes unnecessary. Dreams are very much important because dreams are playing a role like a catheterization, removing all kinds of toxins from your cells and body. But too much dreams are not at all good while sleeping, while going to the sleep, deep sleep, or while coming back from deep sleep to awake state. Both times we are getting the dreams. That times we should decide whether we need to watch more dreams or we need to reduce the dreams and get awake. So if people are practicing yoga, we have observed the dream, the sleep, the spending time on the dream sleep, REM sleep was less, and they spend more time in deep sleep. So their memory was sharpened. So where is the solution? Solution is not only something which I'm looking at in medicine, but so solution is in Ayurveda, in yoga, and our Upanishad around 5,000 years back knowledge now I'm talking about. And these are the today's problem, but solution we are trying to look at today's technological development. I think still we have to look at some other aspect, because diabetes is still not controlling, cardiovascular disease keep on increasing. If you look at neurological problems, the children are now in devastating state. If you look at the children are having ADHD, and autism is keep on increasing in the children. Neurodevelopmental disorder in the newborn children is keep on increasing in the metropolitan cities. If you come to Bangalore, if you go to Mumbai, Delhi, Pune, Hyderabad, the abnormal children, the special schools are keep on increasing. The number of schools, special schools are keep on increasing. That they are going to treat, that they are trying to treat such kind of children. So solution, where are we looking at this solution? Solution is sometimes we say that we have to integrate some ancient Indian knowledge along with the modern medicine. So therefore, there is a concept of yoga come up. Today, yoga is world-known concept where people are talking about yoga practices, including yoga asana, posture, pranayama, meditation, which is in a combined, it is a lifestyle modification. So yoga is nowadays it is become a lifestyle modification that includes sometimes even diet, that includes sometimes your pattern of living, pattern of thinking, pattern of so many other activities. Sometimes yoga becomes an art of living. The way we get up in the morning till we go to sleep, nowadays people are following unique way. That's called lifestyle modification. And there the wisdom comes. As I told you, Ayurveda is having the solution. There are so many studies have been done or they are already in process to understand how these Ayurvedic herbs can rejuvenate the cells, rejuvenate our organs or tissues, and these concepts also imbibed with yoga practices. And the concept of mental control, which is given in yoga and Veda and nutrition, is very much important because any problem, as I told you, any problem starts at the mental level, psychosomatic, any problem, and entire yoga practices. If you take any yoga practices, yoga posture, yoga meditation, or breathing techniques, everything is trying to control the mind because uncontrolled mind is like a monkey mind, and that is going to create problem for the entire physiological system. And nowadays we are having so many studies which demonstrated that yoga is very much efficient to control the mental activities, and it is promoting the positive mental attitude, mental processes, which is associated with cognition, attention, perception, cognition, everything getting improved because of yoga practices. So yoga is something which is, as I told you, which is talking about the mind, which is trying to control the overall mental activities. The yoga is a technique to calm down the mind, which is ways back, 5,000, 6,000 years back knowledge. Now we are trying to implement in today's healthcare system along with the modern medical system. And therefore, in every healthcare units, all aims or any medical hospitals, we are trying to implement a yoga unit, a yoga therapy unit, where we are dealing before going for any kind of surgery or before going for any kind of chronic treatment or chronic problems. We are dealing with yoga. We are trying to give some kinds of yogic interventions, including or yoga therapy, to those patients who are having these some kind of non-communicable problems or any communicable problems also. During surgery, there is a recent study suggests that during this cardiovascular surgery, people have given some kind of breathing techniques to the patient, and the rejuvenation and the recovery was better. Those who got this breathing technique compared to the non, compared to the control group. So this was studied in controlled condition, and they found significant improvement by following yoga intervention. It is also a technique which is, as I told you, yoga is not dealing with the body; it is dealing with the mind, and mind is trying to control entire body. And as you know, modern medicine is talking about body is made up of something, but we deal with something else. So as I mentioned, this knowledge of yoga is given something is given in Bhagavad Gita. A Bhagavad Gita is the scripture which is the only scripture in the world which is given in the battlefield. Today we all are in the battlefield. Say today we get up in the morning, we go to the job, it's a kind of battlefield. Every day is a battlefield. And we all are working so hard to get the prosperity, to get the mental peace, tranquility. But are we getting it? It's very difficult to get it, and this stress level is keep on increasing it. And because of this stress, what is happening? The development of our body, the development of our identity is keep on diminishing. Is keep on diminishing, and the concept of stress is given in Bhagavad Gita ways back by Krishna. He mentioned that Dhyayato Vishyanaponsha. He mentioned that why we are getting this stress. What is the major cause of the stress? As I told you, we have to look at the cause, not for the symptoms. If you treat the cause, symptoms automatically will go away. Automatically, symptoms will go away. But what modern medicine does, I'm not always criticizing that, but I'm saying that modern medicine try to suppress the problem by treating the symptoms. Unless we don't deal the problem, if sometimes, unless we don't change the lifestyle of the patient, we cannot come up with the solution. We cannot deal with the problem efficiently. In Bhagavad Gita, he mentioned, if we run behind any kind of object, if we have any object which is I'm very much attached with that object, maybe my goal of my life, maybe some kind of object like a car I want to buy within this year, or some of my neighbor got one new house, I want to build a new house. We are attached so much with those objects, or we are getting so much attached with some kind of person. So what is going to happen? It is going to affect our mental activities. It is going to affect our. So that's what it's saying. Krodha. Dhyayato vishyanapumsa sangaseshu pajayate sanga sanjayate kamat krodho vijayate. It means when we are focusing only on object or any kind of person, we are trying to get attached with that object. If we think that I have to get this object, however I have to get this object, I have to achieve that target. Okay, when we are having this kind of thing, and if we don't achieve, the anger comes in the mind. Anger comes. If, for example, if you purchase a car, which is very much you are attached with that, if somebody has made some kind of damage, you will get very much annoyed. It sometimes it is good, but that anger has to come down because anyhow it is an object. Because of this anger, if you kill somebody, it's going to be a little bit narrow-minded. It's a become a psychiatric problem then. If we kill somebody because of the damage in the object, and we could not able to achieve that some kind of target. That is happening in the society. Our people thinking are so short, they could not able to look at a broad vision. They don't have a broad vision of the society or of our own vision. And because of this anger, Krodhati Bhavati Samoha, we get so much attached with the object again. And because of this attachment, Krodhati, because of this attachment, anger, we disturbed our awareness. That's called Samoha. Again, infatuation comes in picture. We are so much attached. Because of this, our memory is getting fluctuated. Our sense of thinking is getting, that's called smriti snatch. It is getting, our memory is getting disturbed. Krodhati bhavati sammoha, sammohat smriti vibrama. And smriti vibhrama buddhi nashat parashati. It means the memory is getting disturbed, and because of this memory is getting disturbed, our intellect, our discrimination power is getting disturbed, it's getting poor, and because of that, our life is getting destroyed. And because of a small stress, which is destructing the entire life, destruction of the entire physiology, destruction of the entire mental processes, is because of a small factor that is called stress. An entire world is working on behind that stress. And in one of the Upanishad that is called Yoga Vasishtha, he has given in Vasishtha Upanishad or Vasishtha Samhita, he has mentioned the concept of disease. As we know, the modern concept says that body is made up of something cell, atom, structure, other things. But according to the ancient scripture, they say that any problem in the body not comes directly. It always comes with the mind. Always body it comes from the mind. Any problem. If mind is agitated, our immune system goes down. If mind is agitated, our health physiology goes down. If mind is agitated, our energy inside the body is getting disturbed. Our nervous system is getting disturbed. Our instability in the body is getting increases. That's what is Adi. So the Yoga Vasishtha, 5,000, 6,000 years back, he mentioned about the concept of Adi and Vyadi. Adi means the mental agitation, and Vyadi means the disease. So he mentioned that any problems comes in the body, it starts from the mind, and mind is getting agitated, it's getting disturbed. Any example if you take, if you while coming to the office or while coming to the workshop, if if you get some kind of news or if you encounter some kind of problem, which disturbs your mind, and once mind is disturbed, it is affecting your breathing. Your breathing is getting disturbed, and your agitations because of your nervous system is getting problem. You will get agitated. You keep on moving your hand. You keep on moving your leg, and your restless state comes. That's called instability of nadi. you will be restless, and your breathing is getting disturbed. Well, these two systems of your body, your breathing system and your nervous system, is getting disturbed because of your mind. It is going to create a problem in three different ways. That is defined in scripture. One is called ajirritvam. Ajirritvam means the body is getting suppressed. You may go, once you are having this stress, you may eat food or you may not eat food. Some people, because of stress, they do overeating. Some people, because of stress, they don't go for food. They think that, oh my God, I am so much stressful. How can I eat food? They refuse to eat food. And there is some problem in eating disorder, where people are refused the food because of some mental problems. But I'm talking about normal healthy people. As a normal human being, when we are doing some kind of stress, sometimes we refuse the food to take food, or sometimes because of stress, because some kind of mental uncontrolled activities, we keep on eating. So two things are there, and sometimes they completely confuse the state. So ajirritva means we are having a suppressed state of body, or we are having over atijirnatva, which is overactivity of the body, or agitated of the body, or kujibritvam, which is also called wrong digestion. Why I'm talking all these things? Because it is very much associated with the healthcare system. And we need to think about to understand by using technological development to develop such kind of instrument where we can categorize people based on the causes, not based on the symptoms. If any disease comes to on me, I should have some kind of modality in the technological development where I can segregate people into different categories, whether their body is under digestion or high, or we can even look at their breathing level itself. We can diagnose what kind of problems they are going to face. And after getting this kind of problem, once we are under digest, because if stress is prolonged for longer duration, for example, for 1 week to carry it forward to the next week, or carry it forward to the next week. Prolonged stress somebody is having, it is going to create problem on the body because we are keep on suppressing the normal physiological activity in the body, and because of this under digestion or the under activity of the body, activity of the body, or over activity of the body, it is going to create problem on the body, physical body. That is called vyadhi. Vyadhi is something which is related to disease. Hypertension, nobody gets hypertension by the by a small kind of stress or small kind of anxiety. But if that stress is prolonged for longer duration, it is going to create hypertension. If anyone is keep on eating the sweet, even sweet people were eating earlier also. A lot of people were eating these sweets earlier, and people were can. It was in our culture to take these sweets to the people's home. Some kind of sweets. Every women they used to prepare some kind of delicious food inside the home for their children. But nowadays people are hesitant. They are little bit scared. Nowadays, if they are eating, they are thinking that diabetes is happening because of sweets. No, because of wrong behavior, because of poor lifestyle, because of wrong habit of eating, because of wrong habit of sleeping, because of wrong habit of physical activity. We are getting the problem of diabetes. We are getting the problem of cancer. We are getting the problem of hypertension. We are getting the problem of any cardiovascular diseases. If you take up any neurological disorder, even Parkinson's diseases, even if you go for dementia and Alzheimer, all these are associated with poor lifestyle. That is not including only sweets. That is not including only the small part of stress, because of the carrying forward that stress over a long period of time. Over a long period of time. Therefore, we have to deal, and later this Vyadi again divided into two. That's become the Avija and Anavija, which I'm not going to detail, but the concept of, as I told you, all these things comes to the body now. Now, according to yoga, we need to treat the cause, not the symptoms. And to understand this, the causes, we need to understand the concept of body. As you know, the modern medicine says our body is made up of carbon, hydrogen, oxygen, nitrogen. These are the elements. And there's so many other factors which are associated with the, like a tissue, tissues are there, cells are there, organs are there, and the entire human body is there. This is the construction of the body. But according to yoga, this is not the construction of the body. According to yoga, they mention that Katriya Upanishad in the scripture it is mentioned that we have a 5 layers of existence. The first layer is called Annamaya Kosha, which we can see, which we eat food. That is called Annamaya Kosha, which is going to affect the body. Second is Pranamaya Kosha, because of our body is having some kind of movement, our heartbeat, our respiration, our brain activities, the flow in the blood. Who is making the flow? Who is making the heartbeat to beat? There is something which is motivating the body to move particular direction. All these organs are there in the dead person also. But why it is not moving? Why blood flow is not happening? Because of the pranama. Prana means the vital energy, the vital force which is absent in dead body, which is present in the live body. When we are having this prana in the body, right? Our body is functioning in a proper way. That can be so. Annamaya kosha is something which is governed, which we can see with naked eyes. Pranamaya kosha is which we can control. Second, third is a manomaya kosha. Manomaya kosha is like a feelings or emotions, feeling, sad, behavior, everything is controlled by the manomaya kosha. Manomaya kosha means man, which is a very subtle, which we cannot see, which we cannot measure. We cannot measure Manamaya Kosha, but we can perceive, we can feel that. Our feelings we can feel, whether we are sad, whether we are happy, whether we are, all these emotions are embedded in the Manamaya Kosha. Then we are moving towards Vijnanamaya Kosha, which is always called intellect, buddhi, intellect, which is having the power of discrimination from the good and bad, yes or no, right? Whenever we do anything wrong, we say sorry. Why? Because Vijnana Kosha say it is wrong, not mind. Sometimes mind does some kind of mischievous things, but we don't say sorry because there is a two types of mind: with pure intellect or lower intellect. Okay, lower intellect something which is imbibed with our desire, हमारी इच्छाएं. We are always running behind the desire. Desires are always inside the Manamaya Kosha. But pure intellect comes in the Vijnanamaya Kosha, where people are able to discriminate. Okay, this is right and this is wrong. This is rational, this is irrational, non-rational. We should avoid these kind of discrimination come in the Vijnanamaya Kosha, which is not defined in the modern literature, modern medical system. And then we reach to the Anandamaya Kosha. Anandamaya Kosha is called sometimes called blissful state, a happiness state, in ecstasy. We are when we cannot able to define. For example, you have done so much hard work to write one paper, research paper, and that paper got published in a very good impact factor journal. Okay, you will get some lot of happiness. Okay, you will get a lot of happiness. That happiness sometimes you may not define, or sometimes when you do something without any expectation, if you do some kind of work or some kind of help for other people, you may feel a very blissful state. You may feel a very peaceful state of body, peaceful state of mind that sometimes you may not define it. If unknowingly you help somebody, that time that's called selfless action. When we do, that time we are getting the Anandamaya Kosha, we are getting the blissful state. That is the definition given in the yoga about the body. What how it is different? I'm not saying whatever modern medical system is saying, but modern medical system is mainly trying to deal with only the physical world, what is in the we can see around us, whatever we can see around, what we can measure through the instrument. But it is not only that, there is something which is beyond that, and we have to develop some kind of technology to measure these subtle aspects. Till today, we are still bounded with the Annamaya Kosha. We still measure the blood pressure, we still measure the body, any kind of neuronal activity by using EEG. EEG is so any physical movement we can measure by using different kinds of tools and technology, but still we could not able to reach about the pranamaya question, how this body is moving, why this blood flow is moving. There is something beyond to initiate this kind of movement. A dead person is also having blood. A dead person is also having some heart, lungs. Everything is inside in dead people. But there is something which is moved out from their body. That's called prana. Prana is also sometimes associated with the Atman, but Atman talking sometimes is a very dualistic manner. People are taking it up. Some people follow the concept of Atman, some people doesn't follow. But we follow the concept of prana. Prana means vital force. It's once vital force go away from the body, body is getting body cannot be gets any kind of movement inside. So these are the different phenomena which is given, and then what is the given? How where is the solution of this non-communicable disease or any disease or any problem in the human? We are looking how we can prevent instead of treating them, how we can prevent. So yoga is talking about always the prevention. So they deal all these five koshas, as I told you, they deal Annamaya kosha, the body can be treated by yoga posture. If we want to improve our health, physical health, so in the yoga we deal with the physical health by doing postures, yoga practices. And generally, if you go in Western, if you ask Western people what is yoga, they will tell yoga is something to move the body or doing some kind of breathing in and out. So these are the practice of yoga. But if we look at an Indian concept, if you look at our ancient concept of yoga, it is mentioned that the Annamaya kosha, which we can see from outside, that can be make strength rejuvenate by yoga practices. That's called yoga asana. Then we move toward the pranayama. Pranayama is something which is improving which is energizing the body, which is improving the vital energy inside the body, which is creating a rejuvenation inside the body. And there are so many studies recently people have done where they have found that when people are doing pranayama, there are so much toxins which are coming out from the body, and there are so much secretions inside the body, including GABA, including dopamine, including serotonin, and controlling cortisol level by just practicing pranayama. So there are changes are happening inside the body, which is helpful for the human system. And then we are having the manomaya kosha. So by doing meditation, by doing focus meditation, by doing some kind of good work, we can control our manomaya kosha. By doing meditation, by doing dharma, by doing dhyana, by doing some kind of satsanga, we can control our manomaya kosha. We can strengthen our manomaya kosha. Vijnanamaya kosha can be improved by doing deep meditation. When we are going a deep meditation, by doing satsanga or bhajan, sometimes it is going to rejuvenate our body. Therefore, now every institution is trying to implement one session of bhajan, which is very much important. And then we can reach the state of Anandamaya Kosha. So we are now with this concept we are looking at the prevention and wellness, and then we are talking about the diagnosis and treatment, which is comes along with the prevention and treatment. Once we prevent our body from the disease by following the lifestyle modification through different kinds of things, if we can control the activities of the body, if we can control the mental fluctuations, we can control the stressful condition, we can move, we can go to a longer life. But it will take time. So for understanding this yogic concept, we are doing a lot of studies with the help of NIT Raipur. We are doing some studies on meditation, and we are trying to develop an evidence behind how this yoga practices. Because Westerns are very much they don't listen all these literatures. They don't look at the Upanishad, what they have telling about it. But as being an Indian, a Hindustani, we should know what is our scripture says about health, what our scripture says about how to maintain our health. So to accomplish that, now there are so many studies people have done. They demonstrated that yoga practices along with conventional medicine can control diabetes, can reduce blood pressure, can reduce hypertension, can reduce the back pain, can completely cure the back pain nowadays. We have patients here in our institution where people have completely cured from back pain, completely cured. The diabetes, pre-diabetic people will become normal healthy people. Pre-diabetic means they were not completely diabetic, but they were more prone to diabetes. We have tested them in the laboratory and we have seen by following yoga intervention, they could able to reverse the activity of the pancreatic cells. So such kind of studies people are doing and trying to understand how these yoga practices are affecting not only yoga, they are trying to integrate with yoga system. So all these things are very much important when we are talking about the healthcare system, and we have to integrate the ancient Indian knowledge, ancient scriptural knowledge, the description given in traditional scriptures. It's our duty to integrate with other modalities, other technological development, and looking at the physiological activities of the body, and looking at the clinical observation. We try to make an evidence-based integrative medicine. And why we need this evidence based? Because we need evidence. If I say your meditation improves memory, it should be defined well by using scientific methods. Unless we don't have these scientific methods to define this, that meditation is improving attention or discrimination process or improving the brain activity, unless we don't have the evidence, we don't show it to the society, we cannot claim that. Because today's era is scientific era, technological era. Unless we don't define, we don't tell, we don't demonstrate that yoga has tremendous knowledge or tremendous potential to bring the normal health in a human being. There are so many studies people have done on yoga, and these research started with earlier concept. As you know, yoga is something which is experiential knowledge. You cannot sometimes experiment it, but because of the sake of the scientific world to demonstrate that yoga is having, we moved towards the scientific experimentation, where we are trying to create a environment in the laboratory where the person can practice yoga over a period of time. And we have seen there are so many changes happen during yoga practices. So these scientific studies started by Kovalenji. So first scientific studies on yoga and meditation started because meditation was very much profound earlier. Yoga asana people were knowing less, but people were knowing India is the land of samadhi, where people get easily samadhi, to reach the state of samadhi. And we have seen so many scientists came all over from all over the globe to India to learn, to see this, to check what are the changes that are happening. And this studies started by Dr. Kovalyananji in 1924, and started one journal that's called Yoga Mimamsa. They've started experimenting these yoga practices in different conditions. And if you see, this is the next box where the yoga practitioners were sitting and he was monitoring them from outside. Sometimes they buried inside the earth because it was known that yoga practices can reduce your heart rate. You can stop your heart rate. You can go in the state of samadhi, your even your metabolic state getting stopped. Your metabolic in the cells is getting stopped. Your cells generation is getting stopped. All mitotic and meiosis process is getting stopped. So such kind of, when people are claiming this thing, this has to be investigated. So a lot of scientists came, but before other people, our own Indian scientist, Swami Kovalenanji from Kaviladham, Lonawala, Pune, he started studying to understanding how these yoga practices are affecting the physiological system, and he started using these studies. And then, with the help of All India Institute of Medical Science, they have done a study on Sri Ramananda Yogi. He was put inside the airtight box, and it was just a vacuum chamber box, I would say. It was completely vacuum chambered box, and B.K. Anand was the scientist who was interested to understand. He was basically looking at doing a lot of studies on animal model to understand this autonomic nervous system, how this autonomic nervous system is getting affected in different conditions in animal models. But then he got interested in the by by reading the literature, Upanishad, all these things, and then he got the information about the yoga practitioners. He was interested. He called one yogi, Sri Ramananda Yogi ji, in the AIMS Institute, and he put inside the vacuum chamber. And that vacuum chamber he was put for 7 long days. There was no oxygen, and there was a lot of followers were there. And they thought initially he might have passed away because after 1 hour, when his breathing rate was completely zero, and his heart rate was completely zero, his all the other autonomic parameters was completely zero. He thought he might be not alive, but as the it was signed, consent was taken. They cannot open for before 7 days. So after 7 days, when 7 days passed, just before the time was closed, the opening time of the box, just before 15-20 minutes, the heartbeat was coming back, the breathing rate was coming back. After seeing this, Anand got surprised and astonished how it is possible, how it is possible to stop the heartbeat, to stop the heart rate. And till today, can you believe there's so many studies people have done on yoga, and that says that the experiment have shown that by practicing meditation, by practicing yoga, they could able to stop their heart rate. They could able to stop their pulse rate. And I'm sure it is not till today in medical physiology we don't have any description or the answer of this kind of changes in the human physiology demonstrated by the yoga practitioners. Till today, we don't have any description about this, how they have done that. Though we have so much development in the technology and other things, but still, and as usual, some kind of unusual demonstration was done by Swami Satyamurti. He was buried under the earth, and then scientist has looked at similar study was done to modulate the temperature. As you know, our temperature cannot be modified. We can regulate based on the environmental temperature, but voluntarily only meditator can does that. So there was a changes in the temperature. It was increased the temperature of their body by 5 to 15 degrees centigrade. They could able to raise the temperature of the body by practicing some kind of meditation. So it is meditation is something which is unknown. Generally, meditation is a self-regulated process, or it is a self-regulated mental process where mind is involved. Person is not sleeping in meditation. Sleep, when people do sleep, it is called unconscious physiological rest. But meditation is defined as conscious physiological rest. The person is completely conscious what is happening, and is also conscious, and he's completely in resting state also. So these things is found in the meditators, and meditators are demonstrated that these many changes can be. And then the entire Western community and Western scientists jumped into yoga research. And if you look at today, more than Indians, the Westerns have done studies on yoga. Hardly we have done 15 to 20% studies. Entire world, there are only 15 to 20% studies we have done in this country. And apart from all 70 to 65 to 70% or 70 to 75% studies people have done outside the country, which is really need to be taken into consideration, and we have to look forward to start some studies on meditation. As I told you, this meditation is not a stop over there. Meditation has shown remarkable changes in the perception and the attention, and it is measured through different kinds of instruments. Generally, we are using autonomic functions by including ECG, looking at the heart rate, the variability in the heart rate. We are looking at skin temperature. We are looking at skin conduction. That's called GSR, galvanic skin resistance. And then we are having some other parameters like a breathing rate. We are having a pulse rate. We are having a gastrointestinal motility. We can measure the muscles activity, because during meditation when a person is resting, the muscles activity is completely zero. It completely goes down. So these are the changes, but still he is in alertful state. Though the muscles are not functioning, but mind is completely functioning. Mind is completely, we say that mind is resting, but along with that, we are in alertful state. So based on this concept, the meditation is also something most of the meditation techniques showed it is improving the calm and alertful state of mind. Some studies say that it is inducing a hypometabolic state. Hypometabolic state means in I think it was Davidson long back 1961. He mentioned that meditation is a hypometabolic state where your metabolic system is completely zero or it goes into suppression state. It is not having any unnecessary activities. So these are the few studies on meditation. Along with that, the studies on meditation showed that the changes in the psychological parameters, because psychological parameters measurement which is subjective, and a lot of studies people have done to correlate these subjective changes along with the objective measurements. And what they have observed, meditation programs improves stress-related outcomes including anxiety, depression. So they could able to cope up. The coping ability is getting improved following meditation technique. The mental state health was improved. The quality of life was improved. Attention was improved. Substance use was reduced. Eating ability was controlled, and sleep. The quality of sleep was improved, and it was some studies on meditation showed that because pain sometimes some till today we don't have any measurement for the pain or subjective measurements are there, but not the objective assessment. We cannot measure the pain till today. We don't have any device. If one of you can come up with some kind of device to measure the pain, I have presented 2 years back, and till today we have not seen any growth. So till today we don't have any assessment or some objective assessment to measure the pain. Generally, we are using some kind of pain questionnaire or pain scale to measure the pain. Pain is something which is not affecting the body. Please try to understand this. It is not only affecting the body, it is affecting the cognitive functions also. Recently, I guess 2020, I published a paper where we have found that the back pain when people are having, it is not only having a physical problem, it is associated with attention decrement. It is decreasing your attention process. It is decreasing your cognitive process and mental processes because the neural circuits which are associated with pain are affecting the neural circuits are associated with attention, with cognitive processes. Because pain is also affecting the prefrontal cortex, insular cortex, your internal association cortex, which is getting affected, and concomitantly it is reducing your attentional process and cognitive processes. Similarly, few studies have demonstrated that because these are using the modern technology, as I told you, now because of this technological development, as at least yoga research, we are trying to put a scientific understanding in a proper method to understand how this body is getting changed or adapt different circumstances when people are following yoga practices. And one of the study was done using fMRI, where they have found that meditation is very much important to preserve the brain structure and function. And any problem in the neurological system or autonomic nervous system or central nervous system is associated with either there are changes in the structure or the function. Sometimes in dementia, because of the structural changes, because of the atrophy in particular part of the brain, the shrinking in particular part of the brain, particular hippocampal region, the memory process is getting disturbed. The memory of the brain is getting, because hippocampal campus is associated with memory, and that area is getting affected because of wrong habits, because of poor lifestyle, because of the stressful condition, which is keep on disturbing the neural circuits. And because of the neural circuits, is when you get distress, the changes in happening in the breathing system. The prana gets disturbed in the brain, and because of the prana, the requirement of the nutrition is disturbed in the brain. The neurons start depriving those nutrients which they require, and once neurons is getting deprived, the structure is getting disturbed, and because of the structure is getting disturbed, the associated function is getting disturbed. People start forgetfulness. memory loss, uncontrolled anger, uncontrolled emotions. They could not able to regulate their emotions because of poor structure of the brain. The brain is getting so much disturbed, the structure itself is getting damaged because of prolonged stress was there. And nowadays people have associated this. This diabetes is not only the diabetes which is associated with pancreas, not only the associated with the insulin secretion, it is affecting a lot of your cognitive functions. Cardiovascular systems, hypertension is not only affecting the body, it is affecting the brain significantly. So we need to understand the concept of meditation. We need to understand the usefulness of yoga. And there are a lot of studies where people have shown that yoga practices not only associated with structural and functional, but also the thought process. Thought process, can you believe that your thoughts are getting affected? You can voluntarily control your thought. Generally, we say that those stressors keep on coming. What are I supposed to do? This is, I could not able to control my thought. I could not able to control my mind. I could not able to control my physical activity. No, everything is associated with the consciousness, cognitive process. Everything is controlled by the brain. If we are practicing yoga and meditation, we could able to control our thought process, and which was demonstrated by one of the study published in Nature. Nature, one of the journal is called Scientific Report, which mentioned that by just chanting, religious chanting, whether it is a om or any kind of prayer or any kind of other activities, but some kind of religious chanting itself can control our voluntary thought process. We can control our uncontrolled, means which is disturbing thought. We can control voluntarily by just doing some kind of chanting. And recently we have done a study on Brahmi chanting and Om chanting. And we have found that when people are doing Om chanting, there are default mode network. Do you believe there is a default mode network which is defaultly active? Because of that, we do some kind of automatic process. We are like every day we do brush, right? But we don't remember 2 days before how I brushed my teeth because it's an automatic process. It is adaptive skills. Similarly, default mode network is associated with adaptive skills. And when stress are coming, when things become a part of life, it's very difficult to control. But by practicing yoga and meditation, particularly meditation, the default mode, the areas which are associated with default mode network was controlled. What it was inhibited. The activities in that particular area was inhibited, and the positive emotion was coming out. The positive association in the brain activities was coming out. That was the tremendous changes happened during the yoga practice. And yoga is not something which is work with hypo or hyper. It is bringing the body to the normal state. It's the optimal state it brings the body. Another study has reported that mindfulness meditation should enhance working memory. As a lot of people having a lot of work, sometimes they are getting exhausted very quickly. Why we are getting very exhausted very quickly? Because of mental load is there a lot. When mental load is becoming higher, we could not able to discriminate whether it is right or wrong. Whenever we are in stressful conditions, sometimes we scold somebody and later we realize unnecessarily I scolded my kid, unnecessarily I scolded my wife, unnecessarily scolded my other person. A wife sometimes scold to husband. Later they realize because of the stress, because of the pressure which they are getting, because of the pressure is getting from the surrounding, from the environment, from the so much load in the brain, they could not able to discriminate between what is right and what is wrong. But meditation has showed that by practicing mindful meditation, it means we should be open, we should be mindful for the current activities, what we are doing. If we are open with mindfulness meditation, mindfulness to be present in the present moment. Whatever we are doing, whatever the instruction we are doing, be present in the current moment. When we are available in the present moment, current moment, we can get rid of from the past or future. And I can assure you that stress is not because of present situation. Stress is because of something happened recently or something happened far long back, or something is going to happen. Always because of future or because of past. We are always getting this stress, and this stress is going to be affecting your entire physiological system. As I told you already, these okay, and then there are some studies on meditation which has showed the perception was getting purified because of the neurons, which is associated with the say, different kinds of functions. Sometimes some bad functions are associated with the or some past bad experiences are associated with our behavior. Okay, so what happened when people are doing prolonged meditation? Whatever the past experiences were there, bad past experiences, negative, wrong past experiences was there. A meditator, a person who wants to go for meditation, they can voluntarily can burn, they can forget those kinds of bad experiences efficiently. And we have found that over a period of long duration of meditation, after 10 years or 8 years of experience, people have rich amount of positive emotions, positive memory, positive discrimination. They can able to discriminate good or bad very efficiently with less duration of time. Whereas on control group, when they are not going for meditation practice, they have a long burden of negative experiences in their life because they are keep on remembering, ruminating the negative experiences, and because of that, they are having a lot of problems. And there are studies that have shown that when you have a backlog in your mind, if your brain is already doing some other processes, your performance is going down. So we have to first concentrate our mind. We have to bring our neurons to be bringing a relaxation state. Unless our neurons are not relaxed, if they're engaged in different kinds of information processing or some kind of different kinds of processes are happening in the brain, our neurons are engaged with that, we cannot focus or we cannot improve the attention, improve the any kind of performance. I mean, so those neurons has to be come together. They get rid of all kinds of problems. They get rid of all kinds of tension, fatigue, stress. Then only we can bring them together, and we have to improve. And meditation does a wonder that while doing meditation, a lot of neurons which are associated with particular function is getting activated, and they come together and process the information. So whatever they were performing in the 10 seconds after meditation, they could perform within 3 seconds. So 70% improvement was observed in meditators compared to the control group who never practiced meditation. Or immediate effect we have seen, immediately meditation improves. Around 40% improvement can be seen in meditation group who never does meditation, but suddenly one day they did some kind of meditation and they found significant improvement. So attention, ability to plan sometimes because of stress, because of other problems, we could not able to plan our activity. But by practicing meditation, there was improving the planning ability was improved, and so many other improvements we can observe by following meditation. So, however, meditation is very important. As I told you, meditation is a hypometabolic state, and we have done some studies in our laboratory. We have a wonderful lab that's called Additional Research Laboratory, and in this laboratory, we are having 5 different domains. One is called cognitive neuroscience, which I am looking for. We are having psychophysiology lab. Then we have a sleep lab. We have a bioenergy lab, which is a new domain. We are trying to develop to understand the energy because our body is always emitting photonic energy, photons. If you go in the temple, you get always positive emotions. There are some changes in the environment. Similarly, our body is always emitting some kind of energy. How to monitor? Earlier, people have developed some kind of Kirlian photography, but now we are developing a little bit advanced version of that, and we are having bioenergy using GDV, gas discharge visualization, which is a new technology we are using in the lab. Gas discharge visualization or EPI, electrophotonic imaging. These are two instruments developed by Russian scientists, and they are trying to trace the energy which is emitting from the body. And what we are doing, we are tracing the energy. If energy is less, we can diagnose that some particular organ is under activity is going on or hyperactivity is going on, or we can give them proper treatment. So we have a bioenergy, we have a psychology lab, and then we have a bioenergy. We have a molecular and genetic laboratory. where we are trying to understand how these yoga practices are efficiently reduce the stress and what are the changes that are happening in the molecular structure, genetic structure, the DNA damage which is happening keep on. Nowadays, if you look at people around 30-year-old, 35-year man looks like a 60-year, 45, 50 years old man. Why? Because of DNA damage is happening very fast. And this damage is not happening because of something, some kind of pathological problem, is because of stress, because of poor lifestyle, because of so many other factors are associated with this kind of DNA damages happening in the body. And we have demonstrated that by practicing yoga, we can reduce the DNA damage efficiently. This is a study we have done long back. This is the one of the evoked potential study we have done around 5 years in the laboratory, and we traced people sensory process and the entire neural axis we have traced, and we have seen with respect to the auditory signal. So we have given them auditory signals by headphone, and we have traced the neural axis from brainstem to thalamic region to pelvic association cortex to the anterior cerebral cortex. And what we observe when people are doing meditation, so meditation, there was significant reduction is happening in the lower region of the brain. So the sensory process was getting stopped at the lower region of the brain. It means brainstem and thalamic region, most of the information is getting filtered. Unnecessary information is not going to disturb your mental activities. That's what is the wonderful outcome we found in the meditation study. It means there is something which is in the brain which is trying to control, which is play as a relay station, as thalamus is playing a role of relay station, but there is something else which is associated with selective attention. So if I need to selectively send some information to the brain, my brain is getting efficiently control my thought process, and only selective information can go to the brain. So such kind of tremendous potentials are having in the meditation practice, and when we observe the lower region was getting little bit improvement. Lower region is suppressing the unnecessary information and improving the transmission to the higher state of the brain. And what we observed, the attention perception was improved. Any information was processing around 500 milliseconds. Within 500 milliseconds, the subject after meditation they could able to grasp that information within 300 milliseconds. So there was change, there was improvement in the information processing for 200 milliseconds. They are quicker than the non-meditators. So this study we have done in our laboratory, and we published paper in clinical EG and neuroscience, and we have seen that there was significant improvement in the neural recruitment was improved. One was that because meditation, when you do meditation, unnecessary thought process goes away, and your neurons are free to process the information. When neurons are free to process information, the amplitude, because which is associated, the amplitude is associated with recruitment, so it is getting improved, and the information getting most correctly. Similarly, we have another called fMRI. fMRI, in that we have observed that there was improve again. It is done fMRI, which is functional magnetic resonance imaging, and we have done a study on chanchalata, ekagrata, dharana, dhyana. Chanchalata means when the person is random in thinking state. When they are randomly, they are getting a lot of thoughts. What are the changes that are happening? And we have observed there are so many areas are getting deactivated, and there are so many other areas which are getting activated during the chanchalata state. But basically, when we have moved from chanchalata to ekagrata and ekagrata to dharana, we have observed the focal attention, the focal region was improved, the attention improvement was increased, the region of, if you see the frontal region activity was increased in meditators when they were doing focused meditation. Similarly, in dhyana session, there are so many regions were getting activated in the brain when they were in dhyana session. Look at the increased activation in the left middle frontal cortical subcortical regions, the white matter, and the other areas like right orbitofrontal cortex, anterior cingulate cortex, and so many other medial prefrontal cortex was activated when people were doing when they were in dhyana state. It means meditation is having some kind of potentials to improve the mental activity, to control the unnecessary processing in the brain. If we control the unnecessary processing which is disturbing my mind at the lower region itself, I'm sure we won't reach to the stage of any vyadhi, any kind of disease state, because we are controlling, we are cutting down the problem from the root cause. Root cause is thought process, which comes from the different sources, from the eyes, from the ear, from the body. But if we cut down, but it is processing from this region only, from lower region to higher region. But if we control here itself in lower region, you don't need to be worried. It can be controlled, any kind of disease efficiently. So there are some studies we have done in our laboratory, and this is one of the studies we have done on sleep, as I told you. We have done studies using Anapanasati meditation, which is given by Isha Yoga, Anapanasati meditation, and the cyclic meditation, which is developed by as Vyasa. And we have found there was significant improvement in the deep sleep, where there was a decrease in the REM sleep. The micro arousal during the sleep was reduced, like before any kind of task, like tomorrow I need to catch the flight. Okay, whole night was disturbed. Tomorrow early morning I need to catch the flight. So it is a problem. So a lot of micro arousals are there. Sometimes these micro arousals are associated with pathological condition like a sleep apnea. A lot of times these are sleep apneic patients also getting disturbed sleep, and by the practice of yoga, we can improve the quality of sleep. So there are one or more study we have done on cyclic meditation, and we have observed when people are doing cyclic meditation. So we have observed there was more activity, neural activity during the target task, but they need less neural activity after the meditation post session. It suggests that meditation improves the efficiency of the neurons. It is not only the recruitment, the efficiency of the neurons was improved, so that there was less activity, the performance was getting better. Similarly, we have done, as I told you, there are so many studies people have done on now meditation, and they have observed that so much changes are happening in the clinical condition, in the psychopathological condition, in the physiological condition, in the perception and performance of the children. So entire the changes are not only happening in the one particular sector. It is overall changes. The holistic changes are happening when people are following yoga and meditation. So with this, I think I can. There are so many other studies. So this is the overall summary slide which I need to share. That by practicing yoga is not having only one component. It starts with yama. Yama is something which is self-control. Self-control like a ahimsa. Ahimsa means non-violence. Satya, truthfulness. These are the basic fundamental things. If we follow these things, yama means self-control. So inside the yama, we have a ahimsa, satya, asteya means non-stealing. We should not steal, or we should not take anyone's idea or steal anyone's object. Otherwise, it is going to disturb my mind. Okay, so and then we are moving to the self-regulation by niyama, means cleaning the body. So in this Shobha, Santosh, Tap, Swadhyay, Ishwar Paridhani, there's different concepts are given in the yama and niyama. Then people can come to the asana. Once we follow truthfulness, once we follow non-violence, once we follow this cleanliness of the body, then we can go for the postures, yoga posture. Then we can go for the pranayama. Then we can control the mind. If we cannot control the mind, there's no meaning to. We cannot think that only medicine can cure the body. Mind is keep on running behind the rasgulla, and we think that after taking rasgulla, we can eat one medicine and we can be okay. No, it is going to create some kind of side effect. It may create some kind of other effect on the body. So unless we don't control the mind, we cannot control the body. So entire this system was given by Sri Patanjali in Patanjali Sutra. That's called Ashtanga Yoga. The each system, Yam, Niyam, Asan, Pranayam, Pratyahar, Dharana, Dhyana, Samadhi. So today I just highlighted you about this meditation, how these meditative practices are affecting the entire brain, entire physiology. And you can see it is a summary slide. This is not only the changing other activities of the body, it is changing your neurotransmitter, your GABA, glutamate, your dopamine, serotonin, norepinephrine, epinephrine, acetylcholine. All these are neurotransmitters are getting affected because of yoga practices. And overall changes that we see: reduction in depression, anxiety, negative symptoms, and improvement in cognition, sleep, and attention processing. So with this, I'm going to close my. I'm going to conclude that we are looking for any problem in the body. We are trying to look at the to diagnose with the equipment, to diagnose with the to deal with the medicine. But sometimes I feel that this is a very limited approach. We should look at a little bit ahead of that. Okay, so nowadays people are adopting this yoga lifestyle modification their routine, and it is given by Thomas Edison that doctor of the future will give no medication. Medication is not going to be given by the future doctor, but it will be interest in patients in the care of the human frame by diet and the cause and the prevention of the disease. We have to prevent, we have to look at the cause, we have to change the diet pattern, we have to look at the human frame. We should not look at the symptoms. Okay, so this is the with this I would like to thank you to Dr. Vikesh sir, who invited me to share my experience and my things about this meditation and healthcare system. And I'm also very much thankful to Dr. Mridu Shah and entire NIT community who has run this kind of faculty program. And this faculty program may be very useful in terms of technology, but thank you to Vikesh sir, who always try to implement some kind of your component in his activities. And luckily, we are doing one collaborative project where we are trying to understand this how heartfulness meditation is affecting our electrical activities of the brain and how it is improving our control over the psychophysiological and brain functions. Thank you so much. If you have any question, please you can ask.
Yes, participants, you can ask your queries.
I'm sure it is something which is not related to your field, but it is very much related to your entire life. Because we know that yoga is a very popular, and when you go outside, we must be having a little bit information about yoga, and we should encourage our people to adopt yoga way of lifestyle, because it is going to reduce a lot of problems in the society. Yeah, please, if you have any questions, please you can ask.
Yes, participants. So I think there is no doubts. There are no questions from participants.
I think there is one question asked about the how to remove this black magic
Yes,
which
yeah.
will affect during meditation. Okay, see, black magic something which is given in the tantra. Okay, so in yoga we say that actually tantra yoga comes out from the tantra. Tantra is something what people are taking a wrong way. Earlier, like a Vashikaran, we have to Vashikaran, Uchchatan, some kind of taking the control over the human, which is not applicable right now and which is illegal because it's not a good practice, and we don't encourage to go for such kind of practices. And meditation is improving the mental ability. How people are getting over to other people because the other person is having little bit less energy inside the body, not energy in terms of the immune system or because of the entire system of the body, including the mind, including the other things, is getting deprived because they are mentally not very much well. So people are taking over their mental control. But meditation, what it does, it is improving the mental abilities, it is improving the mental efficiencies, it is improving the overall activities. If something is negative, if any negative emotions comes, meditator can perceive and they can get it or they can put it out or they can stop that negative emotion at that time itself. That kind of potential meditations are happening. So meditation is not going to remove the negative effect, but meditation is efficient to make your body to ward off this kind of negative energies which is coming. And it is negative energies are creating a lot of problems in the, if you go in Assam or if you go in maybe rural areas, it is very common nowadays. But if person is healthy and mentally stable and doing some kind of practices, I'm sure such kind of energies cannot affect them. Cannot affect them.
Said also raised his hand. Rohit, any questions?
I was just asking, like, if a way, like, how do we know if there are certain subtle changes happening inside the body following meditation? What is the way? Say, your one thing I experienced when I was doing meditation, that my heart is calmed down, my heart is relaxed, I can feel the pulses. But if there are certain subtle changes that are happening in different koshas in your body, what is the way to analyze those things?
Okay, so as I mentioned you, so far we don't have any instrument. It is an experience. By that people we are analyzing it. So far we don't have any instrument to measure the energy changes, the experience which we are feeling it. But by we have but by the scientific experiments we can infer that there are changes happening in the cardiovascular system, there are changes happening in the pulmonary functions. There are changes happening in the entire physiological system following yoga intervention. So there are studies people have done on meditation there where they have found that there is an axis in the brain that's called HPA axis, hypothalamic pituitary axis, which is getting affected directly by the meditation and which is controlling the entire stress stressful events changing inside the physiology. It can completely ward off. It can be completely controlled if person is doing meditation. So I think it is meditation is efficient to control the heartbeat. Second is efficient to control the breath rate and efficient to control the entire mental fluctuations, which you have already mentioned. So there are no instrument is there on this right now to measure the subtle changes, which is very subtle, which is not in physical in nature. We don't have any equipment right now. You think about it,
Sir,
if you people can develop some such kind of equipment.
hello, sir. Good afternoon, sir.
Very good afternoon.
Sir, I have a problem. I feel noise in my head. I have done CT scans, MRIs, and other EEGs, and nothing was found. How to avoid this, sir?
No, I didn't get your question.
Sir, I feel sound in my head.
You feel sound in your head.
Yes, sir.
Okay, I think this is something kind of okay, fine. You feel it is. I think this session is. You can talk me separately because it is something your personal problem. If you have any problem related to the because it's something which is we can tell you what are the solutions in that, and because this sound may be having maybe associated with lot of preconception. Okay, sometimes these sounds are coming because of the preconceived, and we need to look at your entire process of that's called medical history. If you have any medical history, so these things, I think this is not the right platform to
Sir,
check it because we need to get a lot of information about your
uh,
Hello.
experiences.
sir, sir,
Hello.
please give me your account, yeah, mobile number. Hello, sir.
Yes, please.
Sir, please give me your mobile number. I will talk to you later, sir.
Okay, you can note it down. 903636
1 minute, sir. 90
3636
3636
7402. If you have any
74.
personal, so if you have any personal question, I'm sure a lot of people, everyone is having problem
Yes,
nowadays.
sir.
If I go
Sir,
any talks, yes, please.
sir, sir, 740
Zero two
2.
two, yeah, 7402.
Okay, sir. Thank you, sir.
So now everyone is having some other problem nowadays. Whenever we go for talks, so people are keep on asking a lot of questions about their personal health care things. But I feel that uh, if you want to get cured, okay, so you need to first look at what is the cause of this, how this problem is started. Unless you don't, because when you go to doctor also, the doctor will ask you, since when you are getting this problem, how many days are over, what time you are getting it. So this is called medical history we have to take. Okay, so I think you can talk personally, and I can suggest you whom to contact and how to get rid of this problem. Surely.
Hello,
Yeah,
sir.
please.
Good afternoon, sir.
Good
Very good
afternoon,
question,
sir.
sir. Sir, this yoga you're talking about yoga and meditation, it is good for health, body
Very
as
good.
well as mind. On the other hand, there are very good black magic that is equivalent to yoga and meditation, which destroying the human mind
Correct,
as well
correct,
as through some kind of evil or some kind of very
correct, correct.
worst kind of the things.
Ghost and all
How
these things.
that
Yeah,
yoga
that's called
helps to get
that's
out of
called
that.
paranormal activities.
Yes.
Yes, this is categorized into paranormal activities where people are getting controlled by some other people. So I think in yoga we don't have such kind of concept. As I told you, if you take any scripture, we are not following this tantra concept. We are following the Patanjali concept. Okay, so Patanjali says that we have eight practices, and by that we can control over our own self, not about on the other.
Yes, yes. No, no, sir.
And
Yes, that is fine. But you have some kind of aura and something like that.
yes,
But that has to
everybody
be
have
stopped.
their
Now,
own
by
one.
doing yoga, you get an aura, and that black magic should be stopped.
See,
Right?
so
Black
far,
magic
if,
should
you,
not.
if I talk about the science,
Mm,
so far I have not seen any study which demonstrated that by practicing yoga or meditation you
mhm,
can control the black magic. But I would say that we are having one instrument that's called GDV, gas discharge visualization, or API. By that we can see the energy system in the body, and we can pre-diagnose the disease. But for paranormal activities or for this kind of thing, I think we don't have any methods to measure it. First thing, there are some kind of I've seen some people are using infrared cameras to
mhm.
measure that, but as such, I have not seen any scientific studies behind that. I've not seen. So, if
But
as a scientific person,
it is 100% proof, sir, that black magic works very fine. Than
yes, it is work. I'm not denying that it is not
yes,
working. I'm telling you, it is comes out from the tantra itself.
yes.
It's a part of Tantra. Tantra is defined already all those things. But I think I never encountered such kind of black magic, and unless I don't encounter or unless I don't get the real evidence of that, I am unable to speak about this black magic.
So there should not be any mechanism in that to control, to avoid or to
See,
destroy.
sir, if we live our life very systematically, if we live our life very in a proper manner, and if we follow all kinds of like a social norms, why people will does black magic to us?
They
Black magic
are
is
more
only
because
happening when people are wants to
jealous.
trouble somebody else.
Yes, yes, jealous. That is the major thing. So jealous. That is the
That's
reason.
it's because of social norms are there. Somebody is violating,
Mm,
and somebody is jealous for somebody else.
yes.
So because of that they do this, but
Yes.
always black magic never works.
Sorry to
It's
interrupt.
unhealthy.
Sorry
Yes.
to interrupt. Govind Swami sir, I think your doubt is clear now.
Yes. Yes.
Sir is
Yes.
related to actually yogas and all. So
No,
please
no,
be
no. Yes,
concise
that is
about your
fine. But
questions.
whether there is
Okay.
a mechanism to control or to
Yes,
not
yes,
do
yes.
it,
Okay, okay,
something
okay.
like that, I have a doubt. That's all.
Yeah, yeah. Thank you. Thank you,
Thank you,
Govind
sir.
Swami.
Thank you very much.
Okay, so we have further more sessions also, validation section. All these questions, please. So thank you so much, Dipeshwar sir, for your valuable time. And yoga is
Priyanka, just a minute. Rajeshwari K, do you have some question? Rajeshwari K has raised hand.
Yeah, thank you so much for the informative session, sir. It was really good. Sir, I have a doubt. Like, can we get any data sets from your unit, SVIASA, for doing EEG?
Yes. What kind of data you want? We have tremendous amount of
Sir,
data. What kind of
okay.
data?
Sir,
What do you like to do with that?
yeah, we are trying to work upon dementia cases. So, any related samples which would really help us?
As such, we right now we don't have we have not collected anything related to dementia or Alzheimer. But we have taken some data on schizophrenia using optical signals like FNIRS, functional near infrared
Okay.
spectroscopy, but we have not done with EEG. So EEG basically we have done with breathing techniques, with meditation technique, different kinds of meditation, and with children we have done some studies. We have collected some data on them. We have not collected
Okay.
so
Can I
far
have
any
voice samples
female
also,
studies.
sir?
Sorry,
Is voice samples also available?
voice sample.
Yeah. Like if there is any kind of language processing which we can do like that,
Okay,
I'm asking.
so no, madam, we have not done any language or linguistic research right now.
Okay. So can I have your contact number?
I just mentioned 90.
Oh, okay. Sir, I'll take it from you. I think
Yeah, you can take
Vijayalakshmi
it from
ma'am.
Videsha or Medusa.
Yeah,
Sir,
yeah. I think
can you
We
provide
will
mail
we
ID,
will
please,
share
sir?
we will share in your WhatsApp group. Okay.
I will share the WhatsApp group.
Yeah.
Okay,
Let me
so I
talk.
think
yeah, yeah.
I will
we
share.
are running short of time,
Yeah.
so we'll be ending the session.
Sure,
We'll be sharing the details required by the participants.
sure.
So thank you very
Thank
much,
you.
sir.
Thank you, sir.
Uh,
Thank
Thank you.
I think this session, what I feel is that this was the best session at the end which we could have, because after the long session of so much of 5 days of sessions, so this session is really refreshing for all the participants, and that's why we kept it at the last.
Thank
So the
you.
best in the last, so that's why we kept it in at the end. Thank you very much, sir, for giving your time, and thank you participants also for making it so much interactive. So with this, I think we will end the session, and we'll be sharing the contact details, email IDs. We will not share the contact details on personal level, but definitely we'll be sharing the email IDs of all the speakers, and you can share your doubts, and you can get help from them through email IDs. So thank you very much, sir.
Thank you so much for
Thank you,
inviting me.
Nitishwar. Thank you, sir. Thank you, sir.
Okay, sir. We'll get back to you soon, sir. Thank you.
Sure, sure, sure.
Thank you, sir.
I may leave now with your
Yes,
permission.
sir. Yes,
Thank
sir.
you.
Yes. Thank you. What is further announcement?
Further, sir, participants can take a lunch break and we will reassemble here at 3 p.m. for validation process.
Okay,
And
Priyanka.
participants have also, they have to also go through the feedback session and your questionnaires. So please, all of you, come at exactly 3 p.m. Further, we will elaborate there.
Yes, you all
Please come
participants.
back at 3.
Compulsory, you all attend. You
Please
all
don't be
attend.
late in validatory session. And Priyanka, when will be the feedback and test?
Sir, it will, this all will be scheduled around 3 p.m.
Okay.
So participants have to come at 3 p.m. and then we will plan accordingly.
Okay.
Okay, thank you, participants. Please be back at sharp 3 p.m.
Okay, sir.
Ma'am, today's recording will also be uploaded, ma'am.
You do it first,
Is that right?
so take just 1 minute only.
Yes, we will upload soon.
Yes, ma'am. Thank you, ma'am.
Yeah.
Please. Okay, sir.
All of you, please join sharp 3 p.m.